Hi, this is TBaldosser, and I'm doing my assessment on Matt here, and I'm going to be assessing his head and neck region. So the first thing I would do is I would come in and I would washing my hands, and introduce myself to my subject. Hi, I'm Trisha.
Hi, Matt.
Hi, Matt. It's nice to meet you.
Super.
So the first thing I do is actually I would observe him, just to see, we're starting with the top and work our way down. So with the head, just looking hair pattern. Do I notice anything that's abnormal, like missing hair, anything, flakes, oozing, anything like that? I look around and I don't see anything. It looks good. It's nice and soft and clean. Smell it. It does look clean. Smell clean. Next thing I would do would be examine the eyes. I don't have an ophthalmoscope, but I would if I was actually using that. So I would take it, hold it in front of him, and I would have Matt, why don't you look over my shoulder here, and I'm going to shine it in. And you're going to be able to see the arteries and the veins of the eye. And one thing that's really neat about that is if you see in there, there should be small, but if they're actually big, it's a sign of chronic hypertension. I'm also going to test the eyes. I'm going to have you look at my finger. Follow my finger with your eyes and not moving your head. And I want to see one fluid motion. Okay, go up and down. Okay. Now with the pen light, I'm going to check pupillary response. So see how if his eye does respond, and if it was there, it would respond. Do the other one, and it does work. So then we look at his nose. Can you look up? And there are no boogers or anything right there. No sinus inflammation or anything. I would take my otoscope, and I would look up there to see if there's anything in there. If he had anything lodged into his nose, which he doesn't. Next, I'm going to have him open his mouth and look to see if there's anything abnormal. Go ahead and smile really big, close your teeth, smile. Can you stick your tongue out? Wiggle it back and forth. Yes, he's very gifted in the tongue region. So I will take my otoscope. I'm going to have you open your mouth. I say ah. Ah. And when you look into, this is my otoscope, you're going to look in and you're going to see if there's anything red, or look at his tonsillar area. And his tonsils do look fine. I'm going to examine the neck. I'm going to palpate both sides at the same time. See if there's any swollen lymph glands at all. And there isn't. I'm going to have him swallow. And you can actually feel it. It feels really good. There's nothing abnormal I sense in this area. The next area I will look at would be his ears. Take the otoscope, and the thing about examining ears is for children, you want to pull down on the earlobe. On adults, you want to take the pinnacle of the ear and you want to pull up. The reason why is because the eustachian tubes, when they're children, they're actually kind of angled down. And so you want to pull down so it kind of flattens them out. And in adults, they kind of go like this. So adults, you want to pull up so you can look in. So you always want to start, if there's an affected side or unaffected side, start with the unaffected side to look at that. Go look in with my otoscope. Look in. What you want to see is you want to see a pearly gray eardrum. No redness around the ear canal or anything like that. Pulling up, looking. And I don't see anything. It's nice and pearly gray. Let me look at the other side. Again, pulling up on the eardrum, on the ear canal, not the eardrum, not the canal either, the pinnacle of the ear. Looking in. I don't see anything abnormal. Pearly gray. There's nice light reflex on it. And that's it. So this is a great test subject. Thank you, Matt.